Yeah, Jose, something is really very similar in Germany. So concerning public medicine, we have a system of private medicine. I don't know if you have this as well. Private practice, all patients pay out of their own pockets as well, the medical procedures. But we want to talk about going to market and stay serious. So you are now the one addressing patients, and you need to do something like marketing through different channels. You need to provide service for patients before they enter the office and afterwards. You need to communicate without words, just by the interior of your office, maybe. You need to select a certain portfolio, and pricing is important, not over the top, not too cheap. Credibility of staff and doctor is super, super important. And if you make mistakes in patient selection or underestimate the importance of your perfect skills, this kills your practice totally. So let's go a little bit in detail. Stay serious, you're a doctor. So you don't need to dance on TikTok. And I heard so many interviews, videos on TikTok or Instagram, totally bullshit. They tell you something about fillers, Botox, and it's just wrong. But it's there forever, almost. You hardly get it out. Provide information. So you are not the advertiser type. Everything you pull out of into the net, into flyers or whatever, should be just information, and then everybody is happy. Office organization, service before treatment. You need to be reachable. It's not possible that a patient tries 10 times to get through. You need to answer emails proper, and that appointments, they should be in time. Maybe a patient understands if some procedure takes longer, but it cannot last 3 hours. Train staff basically to explain the procedures and downtimes upfront. Of course, you need to explain that again, but the more the patients know, the better is this speaking to the patient. And assist also with travels, hotels, if requested. Your office organization service after treatment. So there must be emergency phone numbers. And this is not just if the patient is almost killed in a traffic accident and the emergency doctor wants to know what happened. It's just if the patient feels unsafe. And so psychological things. There must be at least a chance for the patient to get through. And I don't charge in private medicine the treatments after the main procedure. So the appointments are free. So I want to get the patient in with complications, with pain, with everything, to help and not stay at home because it costs extra money. Your office ambient. So if you go into an Apple store, you know what it's all about. It's high tech and it's nice, it's light all over, and it's expensive. So, but it works. And this is something you can transport without words. Your portfolio and procedures. Particularly offer procedures which are requested frequently, in general frequently. So you cannot offer only exotic or expensive procedures. The people come in for Botox, fillers, laser epilation. We here talk about procedures you can add to your normal office, your normal vascular surgery office. And be careful buying expensive devices. Frequently, the sales reps' calculations of profits are unrealistic. So the prices you can get usually are over the top, and the number of procedures as well. And at the end, these prices nobody pays, and the number of procedures maybe half or less. Choose the right pricing for cash-based procedures. Watch the market around you. You cannot be the cheapest one. People do not appreciate that. They do not respect your work adequately. Yeah? So you have to face, people have to go to the hairdresser, they have to fill in gasoline in their car, and they have to buy new tires, and they have money for everything, so they need to pay you as well. But you cannot be too expensive. If you be too expensive, they will not come again. The credibility of your staff. You need the right people, particularly on the front desk. Yeah? You cannot sell baby skin and then you have a 70-year-old lady at the front desk. Yeah? So as long as you treat 70-year-old patients, this is fine because she connects to them and she's the friend of your patients. But usually aesthetic patients are younger, and so you need to take care having the right people on the front desk. The same is true for the doctor. If you offer liposuction, as a doctor you cannot have a body mass index of 35 or 40. So the credibility is you. Yeah? So luckily we are frequently a little bit older than our patient, so they forgive us a little bit. Yeah, that's life, sorry. Yeah, and to whom are you talking? Yeah. So, patient selection, that's truly, truly important. Beware of dysmorphophobic patients and patients with unrealistic expectations. So, patients who make a big, big deal of nothing, yeah? So get rid of them. Decline 1% of your patient, this saves you 99% of your trouble. So this, at the beginning of a cash-based practice, usually you want to take every patient. You think, yeah, I need a revenue, whatever, but this is wrong. Yeah? So you always need to be on the safe side, and there are so many psychos around, you cannot even imagine. And train yourself at the best places. Look who does it well, try to visit such colleagues, take the best courses. Your skill is what brings you forward. Yeah? And this gives you then great result, positive feedback, and recommendations of the patients to their friends and pals. And then I have one extra tip. Consider an image video, because here you can bring in everything we talked about basically. This is Mannheim, the city where the first car ever built drove.
Von Professor Dr. Proebstle.
And just introduce yourself somehow with where you are, what is your office, what are the girls take you. This makes the patient feel comfortable once he enters your office already.
Dass ich mit meinem Beruf Menschen dabei unterstützen kann, ihr individuelles
Show your
Schönheitsideal zu erreichen.
key procedures you offer. Such an image video is done in 2 hours or 3, yeah? And if it's a professional team that produces such an image video, it's not too expensive, but it looks professional, much more professional than the TikTok or the Instagram videos many colleagues produce where you think, oh, you should have not done this. Yeah?
Minimalinvasive ambulante Venenbehandlung bedeutet, ohne große Operationen sofort in den
So you
Alltag
can explain a few things and yeah, give the patient an idea what you have.
Und setzen stattdessen auf elegantere, gering belastende
So
Behandlungsmethoden.
I think with that we can stop at this place, and I want then conclude that you can make a lot of mistakes and step into a lot of traps starting to run a cash-based office. But if you want daily success and fun in your office, you should think about those things, and it will pay out for you. Thank you.